Hi everyone, and welcome to Module 2. In this module, we begin to build the foundation that supports effective program design in physical activity and health. More specifically, we'll examine the role of epidemiology in disease prevention, explore public health approaches to health promotion, and learn how to analyze epidemiological data to identify trends, disparities, and risk factors across populations. Epidemiology gives us the why and the where, helping us understand who is most affected by certain conditions, under what circumstances, and why those patterns exist. This perspective is essential for designing programs that are not only effective, but also equitable and responsive to real-world needs. You will also be introduced to program planning models, which serve as structured frameworks for developing health promotion programs. While there are many models in the literature, most follow central core steps, including a needs assessment, goal setting, intervention development, implementation, and evaluation. These steps will guide much of our work throughout the course. It is important to distinguish models from theories. Models act as the blueprint for how we plan and implement programs, while theories explain why we expect certain interventions to influence behavior. Both are necessary for strong evidence-based program design. A major focus of this module is social determinants of health. On your discussion board assignment, you will respond to 2 prompts, examining how factors such as environment, education, access to care, and social context influence health outcomes, and how public health and healthcare professionals can work together to address these determinants. You will also consider challenges, measurement limitations, and successful real-world efforts to reduce health inequities. On your Module 2 assignment, you will shift from population-level thinking to individual behavior change. You will identify specific health-related behavior, either one of your own or someone else's, that you would like to change. Using health behavior change theories such as the health belief model, theory of planned behavior, or trans-theoretical model, you will develop a structured, realistic plan for modifying that behavior. Your plan should clearly describe the behavior, explain its relevance to health, identify the theories guiding your approach, and present step-by-step evidence-based strategies. You will also address potential barriers and practical solutions, demonstrating how theory translates into applied program design. Be sure you look at the module to learn formatting, page lengths, and terminology and concept inclusion. At the end of this module, you should have a stronger understanding of how epidemiology, social determinants of health, planning models, and behavior change theories come together to inform thoughtful, effective physical activity and health programs. I look forward to reading your discussions and assignments. So let's get started.